DaSH is the Diabetes and Sensory Health Study. With colleagues from Waipapa Taumataro, the University of Auckland, we're running a study that will take about 1 year. I come from an eye health background and I have wonderful colleagues working in foot health and hearing health. So together we're thinking about eye health, foot health and hearing health as sensory health, and recognising that all of those conditions often co-occur with, particularly among people with diabetes, to find solutions where access to each of the services for each of our areas of interest can become easier for people who have one or more of these conditions. For each of those areas of health, there's very limited public funding available for people who don't have the resources to access care in the private sector. So how we've arrived here at Taruki this week is we, across 4 areas of Aotearoa, counties Manukau, Tairāwhiti, Te Tai Takaroa and Lakes, we've randomly selected 33 clinics, and one of those clinics was Taruki. We are then able to randomly select up to 90 people enrolled at each clinic and invite them to come along and participate in the study. The response has been overwhelmingly positive, and it's been great to just meet so many people across the motu. And I think one of the things that's really come through is that people are recognising the benefit of like a one-stop shop, so not having to go to all different appointments to look at different areas of health, but they can come and have everything looked at the one time. So one of the things we're doing in this study is, I guess, to quantify the extent of unmet need that we're dealing with across these conditions. We're aiming to work together to try and identify ways that services could be more accessible. Foot problems and eye problems are very common complications among people with diabetes. One of the ideas that's well known but isn't implemented is, for example, people are invited to regular retinal screening, so photos of the back of the eye to check for diabetic retinopathy, which is an eye complication of diabetes. And often at those appointments, people receive drops for their eyes, and so that would be, and you have to wait, and so that would be a very useful time to get your feet checked because you're already at the clinic. But at the moment, those appointments are scheduled on different days, and they can be 2 days apart or 2 months apart. But an example of how services could be made more accessible is actually scheduling them at the same time. There is emerging evidence, and I'm certainly not a hearing expert, but there is a connection. So people with diabetes are more likely to experience hearing loss. So it's not as direct a link in terms of eyes and foot problems with diabetes, but there is emerging evidence that there is that connection. If you have vision problems, hearing problems, or foot problems, one of the connections we see between those 3 things is an increased risk of falling. And so the grip strength is a proxy measure for frailty, which is also associated with falling. So we've included that physical assessment to look at amongst our whānau who participate in the study. The project is funded by the Health Research Council of Aotearoa, and also we've been really fortunate to get a lot of philanthropic support. Next month, we're able to offer anyone who needs a follow-up eye examination and glasses. We're able to offer that to whānau and to provide those glasses at no cost. And so that is possible through an organisation called One Sight Luxottica. The New Zealand Association of Optometry has also been extremely supportive to offer broader services because of that support. Coming to Taruki this week has just been one of the most special experiences we've had, and meeting people enrolled here, and they just feel so much aroha towards the practice. It's a very special place and it's been fantastic. Really keen to explore, as part of what can be done to improve access for whānau. Hopefully, it's a beginning of a collaborative exploration of that.